HIV, here's more of the World AIDS Conference that was held in Melbourne earlier this year.
So my name is Jessica Whitbread. I'm currently the Interim Global Director for the International Community of Women Living with HIV, ICW. We are the only global for and by network for women living with HIV, which makes us quite unique and special. We started in 1992 as a response to women feeling that our needs were not being addressed at an international level. So at the Amsterdam AIDS Conference, a group of fierce women stood up and said, "We are the international community of women living with HIV." It was a bold and beautiful statement, and we carry on their legacy today.
My name's Mark Stoove from the Burnet Institute in Melbourne. I head the HIV research program in the Centre for Population Health. The Burnet Institute is a major biomedical research institute in Australia, and we deal all the way from bench science right through to biomedical research, through to public health and program prevention work both in Australia and internationally. We've seen remarkable changes in HIV epidemiology and prevention and transmission over the life of the epidemic, from the awful period early in the epidemic when we didn't even really know what we were dealing with, through to broad-scale transmissions globally when we had no effective therapies. The major change came in the mid-1990s when effective therapies were developed, and then there was an ongoing period of challenge to try and bring those life-saving drugs down in price so that they could have a major impact on where the burden of HIV is and was at the time, and that's largely in developing countries. And that's been the fantastic story, I guess, over the last 10 years or so of the epidemic, where we are seeing major declines in transmission of HIV thanks to the rapid expansion of life-saving, highly active antiretroviral therapies being provided to developing parts of the world. Where we are doing less well, and this partly relates to stigma, discrimination and the legislative and policy and cultural environment of certain risk practices, is in relation to people who inject drugs. Some of the key parts of the world where we are seeing increases in HIV transmission are among injecting drug user populations, and I don't think it's any coincidence that those locations are also parts of the world that tend to have a legal and legislative framework that actually outlaws some key prevention mechanisms, particularly in relation to the outlawing of the distribution of clean needles and syringes, and in some parts of the world the classification of opiate therapies such as methadone and buprenorphine as actually illicit drugs themselves.
Every year more than 2 million people are newly infected, about 4 people a minute. Every year, 1.5 million people still die from age-related illnesses, about 3 a minute.
As a feminist network and a feminist myself, we're particularly concerned about gender oppression and how that leaves not only women more vulnerable to HIV, but once women contract HIV, it leaves us more vulnerable for many of the other systemic injustices that exist, which include, difficulty accessing treatment, difficulty getting sexual and reproductive health and rights services. Our rights are not even acknowledged in many cases. Property rights, inheritance rights. Women living with HIV are often increased greater risk of violence in their homes and in their communities. One of the issues that we're working on right now and very adamantly pushing is the forced and coerced sterilization of women living with HIV.
We also work a lot with trying to develop community-integrated models of prevention, and particularly we've been working closely with the Victorian AIDS Council here in Melbourne on the development of peer-led and community-based rapid testing, whereby the gay community other men who have sex with men are trained to use rapid HIV testing in a community environment and deliver testing to members of their own community, thus addressing some of the stigma and discrimination issues around or the comfort with which people feel they can engage with the medical sector, and also provides a very convenient and quick method of testing.
We're from Kirgizstan, which is in Central Asia, and the HIV situation is, just like everywhere, it's on the rise. And here we have brought our Equality Caravan. It's an innovative advocacy platform, which is a mobile one, and we've basically circled around a lake in our country with 18 activists from different affected key populations and stigmatized communities as well. And the basic idea is that we do face-to-face advocacy with the general population, kind of bypassing the general media, which usually have their own prejudices about our groups. So it was just like, you have questions about LGBT, well, here I am, ask me. Or you have a question about how it is to be a person with a disability, then this is my experience. So, and here are some photographs that we brought with ourselves. Unfortunately, our exhibition was supposed to be much bigger. We were planning to bring our quilt, like what we call the talking quilt. It has stories of people written into them. But basically, our exhibition was not let out of the country, and our third person from the booth was detained at the entry. At the border, because of a homophobic situation in the country, and there's currently a draft law that's being discussed which prohibits propaganda of homosexuality in general, and so our materials might have been considered as propaganda, so they were not let out. So this is the only stuff that we could put up here. So.